The unknowns of COVID-19 are forcing new measured risks into healthcare every day.
And it's a really difficult balancing act.
Dr. Stephen Davis is a public health educator at UNT-HSC.
Hospitals are going extreme lengths to ensure the safety of patients and also members of the healthcare team.
A healthcare worker at Baylor Scott & White emailed us a memo sent to their team reading, "If someone close to you gets COVID, you continue to work until you are symptomatic." The worker wrote it puts coworkers, families, and patients at risk.
So I can certainly understand their fears.
If there are critical staff shortages, CDC guidance allows healthcare workers who have had unprotected exposures to the virus to work if they haven't had symptoms or tested positive.
I think that the CDC is responding to the reality that hospitals do have critical staffing shortages.
Baylor Scott & White, along with Texas Health Resources and JPS Health, confirmed they're using that policy. Chief Nim Kidd, the head of the state's emergency management division, said there are shortages statewide.
So instead of taking people out of operating for up to 2 weeks at a time and having them isolate, there is a need to be able to use those healthcare providers as well.
But the CDC also says 50% of the spread of COVID-19 is coming from people who haven't had symptoms.
So yes, there is risk associated with this. But again, we are all learning at the same time.
One concern is the guidance is broad, and the hospital groups, Chief Kidd and Dr. Davis, all had different interpretations.
We're learning as we go with coronavirus. So I do think that we will see policy changes as a result.
In Fort Worth, I'm William Joy.
You know, we also reached out to Parkland, UT Southwestern, and Medical City to see if they're allowing exposed but asymptomatic employees to continue working. So far, we haven't heard back.